For my disease investigation project for human diseases, I decided to pursue testicular cancer. It was a disease that I knew very little about. I am familiar with a variety of cancers, but I know the least about testicular cancer, so I figured other people might want to know more about it too. In reality, it occurs every day. People are diagnosed every day, and one day that could be your best friend or your neighbor or even a family member. And I think it would help the world out a little bit, and maybe even people in your life, if we all knew a little bit more about it. So that's why I decided to kind of challenge myself and pursue a disease I didn't really know a lot about originally. And my name is Stephanie Masulo. I am a public health major. I've decided to concentrate in health studies online. Historically, if you were diagnosed with testicular cancer, that was very bad news. We were still finding out the long-term effects and, short-term effects of radiation therapy and chemotherapy and what the different doses meant and, how to specifically target certain parts of the body with cancer. So your chances of dying were a lot higher. But that's not the case today. The incidence of testicular cancer has increased recently, at least in America. So thanks to scientific studies and the collaboration of medical professionals and individuals of the public health care field, we've through time been able to develop more efficient screenings. And one of those screenings is if a doctor is concerned if you do have testicular cancer, they're going to ask for a urine sample. And they're going to test for a number of things in the urine sample, but one thing they're going to test for is the presence of certain proteins. And if there's a presence of certain proteins, then that will be your body, unfortunately, but fortunately, communicating that there is a presence of testicular cancer and specifically what stage of testicular cancer you have. This is important because it allows your oncologist to design an appropriate way to tackle what stage of cancer you have, so what treatment plan is best for you at that time. I wasn't sure how common testicular cancer was before diving into some research, but apparently in America at least 1 in 263 men are diagnosed with testicular cancer at some point in their life. The average age is 33. If you're younger or older, you can still be diagnosed. But the risk of death is very low, and I was really happy that Duke was involved with research in regards to this disease. I love Duke. They're located in Raleigh, a very wonderful hospital. And so they just had something comforting to say about that. No one wants to be diagnosed with cancer, but they did state if you're concerned about testicular cancer, the first thing you should know is that it's highly treatable and very curable. In regards to the face of testicular cancer, how it may look statistically in America, I kind of tried to see any information that may have helped measure the prevalence or the incidence or the mortality rates. And what I found was in 2017 specifically, there were 8,850 individuals who were told that they have testicular cancer, and 410 deaths were recorded as testicular cancer being the cause. But sometimes, with death, we're not able to really honestly pinpoint what caused the death. So just keeping that in mind, it could have been more than 410. The first step to being able to recognize the red flags or the warning signs or the risk factors of any disease is being aware of what they actually are. So that's why I wanted to include kind of overlapping red flags that were provided via the numerous and excellent resources I was able to conduct my research. So if there is abnormal, unusual, or new lumps and swelling in the testicles, communicate that with your doctor. They're there for you, to ensure your best health, not just as a last resort when you're sick or dying. Also, tender breasts can be a sign of testicular cancer. Every sex has breasts. It's just anatomically and biologically true. They can become sore if that's where the cancer has spread or just because of the cells in which the cancer grows. I know that sounds kind of odd, but it is a warning sign. Also, if you have a family history, obviously be more aware of those red flags, communicate that with your family. And it's usually addressed in adolescence, but undescended testicles does increase your risk. I also included a red flag profile. I thought it was really neat that they put that together. So the face of testicular cancer, someone more likely to be diagnosed with testicular cancer would be a Caucasian male between 15 and 35, with the average age being 33. Definitely be proactive about taking care of yourself. You can't control a lot. Being diagnosed with cancer, you can't help that, but there are certain things you can control, like, again, being educated on warning signs. Take control of your health. If you could do something as simple as a self-exam at home once a month, do it. And so I included a couple simplistic diagrams that I thought would be helpful if you're interested in taking a look at those. Most diseases involve a number of tests. With cancer, there are two different kinds, two different categories. There's a lot of different kinds of tests, but as far as the major umbrella categories, there's going to be screening tests and then diagnostic tests. Diagnostic tests are going to be more specific and more expensive. A screening test like the self-exam, you can do that at home by yourself, but diagnostic tests you want a professional to do. I wanted to list a few of the effective diagnostic tests that your oncologist or your healthcare, medical care providing team may suggest that you pursue. They won't suggest anything that you're not going to benefit from. So if any of these seem overwhelming, just communicate that with your doctor and they can break it down a little more. One is an ultrasound, one is a blood test, a biopsy, and then the CT, PET, and bone scans are specifically more so to determine if the cancer has spread and, again, the stage. So some of these tests can seem scary, especially if you've never heard of them before, or even if you've heard of them before but it's your first time. Some people are claustrophobic, so that can make something like a CT scan seem unpleasant. Again, just communicate with the technician that's with you or communicate with your doctor, bring a friend. Do whatever you have to do to make sure that you are able to get these tests done. But they are there to help you, not just, physically with your cancer, but emotionally and mentally too. So there's going to be a lot of new terminology that's going to get broken down for you when your cancer is explained. There's not just one type of tumor, there's a lot of different kind of tumors depending on what part of the body they're in, if they're spreading, if they're not spreading. So specifically with testicular cancer, something called germ cells are involved. You may have heard them when people are discussing ovaries as well. They're common there as well. But 95% of the malignant tumors are going to be from germ cells. Diving into your actual treatment plan once all the tests are done and it's specifically explained where your cancer is, what stage it's at, and what your medical provider and that team needs to do moving forward to address that in the form of treatment. It may be suggested that you undergo a surgery, that you participate in certain rounds of radiation therapy. There's also something similar but very different, chemotherapy, and then stem cell transplants. So different people react to radiation and chemotherapy in different ways. Some people say radiation therapy is a breeze. Some people say chemotherapy is a breeze, and vice versa. They're usually like one or the other. Hopefully you won't have to do both, but it is common to do a combination of surgery and radiation therapy. And it also is common to ask off of work, since sometimes people, again, they react to it differently. They may be more tired afterwards, or not feel like eating, and then that takes away energy. So just be aware of those things when you're tackling this. You don't have to do it alone. Again, you're going to have a team of specialists involved as well. Take advantage of having your oncologists and your urologists and even a social worker available there for you. And even financially, people don't expect to have cancer, so they don't have a surprise cancer fund, in their back pocket. So that's why they're there to help you. They're there to address those things, so you don't have to stress out about it. The best thing you can do for yourself after any major diagnosis, such as cancer, is to pursue treatment as soon as possible. So it's okay to be overwhelmed. It's human to be overwhelmed, but don't let that stop you from pursuing treatment as soon as possible. You're going to have a team of people scheduling a lot of appointments, and again, there's going to be a lot of CT scans or PET scans or terminology that's describing the results of the blood tests you just did that you may not understand or be familiar with. Just talk it out with your doctor, or talk it out with even the technicians or the nurses. The nurses can be your very best friend, and they can break down a lot for you as well. And there are other organizations outside of the hospital social worker designed to help individuals who have to suddenly arrange their life around their cancer until they hopefully recover from it. I listed a few specifically that I found were helpful for individuals that had had testicular cancer in the past, and they're here for you to view and explore if you would like. I wanted to include a few ridiculous things that I came across when I was actually researching testicular cancer. You have to be really careful about what sources you go to. Sometimes people are trying to sell stuff. So if you look at the bottom to see who's sponsoring what you're reading, and again, make sure they're not trying to sell you anything. It could be pretty ridiculous what you find on the internet. I was fortunate enough to come across a lot of very reputable journals and a lot of wonderful sites. Usually .org or .gov tends to be the safest to pursue. But I just wanted to include these kind of mythbuster topics in case you were also curious about them as well. For the Healthy People 2020, they had a lot of resources that were published in a lot of different years. I think I saw some from like 2013, 2016, 2017 that discuss the topic of cancer and even cancer's relation to cardiovascular disease, which I think is, again, a wonderful resource and wonderful things to read up on. But specifically in regards to testicular cancer, they basically said, talk with your family if there is a family history. Make sure that you're communicating that with your doctor and screening. So be proactive about it, but there is no magic cure. There's no magic diet. There are no scientific studies that support that certain lifestyles are going to prevent you from ever being diagnosed with testicular cancer over other lifestyles. again, just be safe about what avenues you pursue when it comes to your research. Make sure someone's not trying to take advantage and scare you into buying something that you don't need to buy. No one wants cancer, but your best friend is literally going to be your medical team or your healthcare team or your social worker, people who are educated about what's going on with your body and what you need to do in regards to treatment. If terminology seems overwhelming or treatment plans seem overwhelming, there's a lot of journals and .govs, .orgs, organizations that have information waiting for you. But again, your best friend in this is going to be your doctor, so just have that open line of communication with them. There's not going to be a coconut oil diet that you can start when you're 20 and then it promised that you never get cancer. So some family holidays are coming up. Just maybe talk with your family about your medical history. It doesn't have to be about testicular cancer specifically, but just bring it up with them.